In the last several weeks, I have talked with several colleagues and done a significant amount of reading and research to really try to dive deeper into this question of what are my postoperative restrictions. And I want to talk a little bit more about that question. In the last several months, we've had two discussions that have really changed the mindset that I have about postoperative restrictions. Number one is the understanding of ligament physiology. Ligaments that are injured, which would include the tissues injured at surgery, require stress to heal. They require movement to heal. And number two comes from our discussion on lower back pain. Fear of movement increases the likelihood of lower back pain. So given those two principles, we have to ask ourselves, why are we telling our patients, and have historically told our patients, not to lift, twist, or bend after spinal surgery? Going forward in my practice, I have made the decision to not have postoperative restrictions in the traditional sense at all. And to not say, don't lift, twist, or bend. I don't like that. I've never really liked it. And I don't think it's the right mindset. The approach that I want to advocate for in all of my patients is we want you to be mindful of how your body is feeling. And we want you to incrementally work towards your postoperative goals. If you want to golf, run a marathon, do a triathlon, hike a mountain, garden, walk with your grandkids, whatever it is, be incremental. Start from the basics and be mindful of your body. I believe that that is the safest and most effective approach to healing after surgery. There are no timelines, there are no restrictions. It is entirely about incrementally improving one step at a time towards your goals. I like that approach. I think it's a very empowering approach for patients. And I hope that patients don't hear that information and think, well, what about this and what about that? Too much. I think that those questions are okay, but it's just as simple as that. It doesn't have to be any more complicated. Every activity that can be considered should be considered with a mindful approach and to be incremental. You want to golf? Great. Start with putting. You want to go hike a mountain? Great. Start walking around the block. You want to get on the road bike or do some mountain biking? Great. Start with a stationary bike and work your way towards those things and pay attention to how you are feeling. There may be some specific situations for which this would not be appropriate, but by and large, my recommendation to patients after surgery is to be mindful of how they're feeling and incrementally work towards their postoperative goals.